What to do if someone is having a heart attack or stroke. Symptoms Part 1. The heart attack occurs when heart muscle is deprived of oxygen, either partially or completely, due to clogged coronary arteries, via atherosclerosis. Without enough oxygen and nutrients, the heart muscle begins to die and becomes dysfunctional, which leads to a heart attack, myocardial infarction, and potential cardiac arrest and eventual death. About every 34 seconds, someone in the US has a heart attack. The physical damage due to heart attack can be minimized by early intervention, so prompt recognition of the signs of a heart attack and immediate transport to a hospital is crucial and greatly increases the chance of survival. 1. Understand that sometimes there are very subtle or no warning signs. Some heart attacks are sudden and intense and provide no warning signs or telltale symptoms. However, in most cases, there are at least subtle clues that usually get rationalized or marginalized. Early warning signs of heart disease include high blood pressure, sensation of chronic heartburn, reduced cardiovascular fitness, and a vague feeling of malaise or being unwell. These symptoms may start many days or weeks before the heart muscle gets damaged enough to become dysfunctional. Symptoms in women are particularly hard to recognize and are ignored or missed even more often. Major risk factors for heart disease, heart attack, and stroke include high blood cholesterol levels, hypertension, diabetes, obesity, cigarette smoking, and advancing age, 65 years and older. A heart attack doesn't always lead to cardiac arrest, complete heart stoppage, but cardiac arrest is always indicative of heart attack. 2. Recognize the most common symptoms of a heart attack. Most heart attacks do not occur suddenly or out of the blue. Instead, they typically start slowly with mild chest pain or discomfort that builds over many hours or even days. The chest pain, often described as intense pressure, squeezing or opchiness, is located in the center of the chest and can be constant or intermittent. Other common symptoms of heart attack include shortness of breath, cold sweats, with pale or ashen skin, dizziness or lightheadedness, moderate to severe fatigue, nausea, abdominal pain, and a sensation of severe indigestion. Not all people who experience heart attacks have the same symptoms or the same severity of symptoms. There's lots of variability. Some people also report feeling a sense of doom or impending death that is unique to the heart attack experience. Most people experiencing a heart attack, even a mild one, will collapse to the ground, or at least fall against something for support. Other common causes of chest pain don't typically lead to sudden collapse. The heart attack occurs when heart muscle is deprived of oxygen, either partially or completely, due to clogged coronary arteries, via atherosclerosis. Without enough oxygen and nutrients, the heart muscle begins to die and becomes dysfunctional, which leads to a heart attack, myocardial infarction, and potential cardiac arrest and eventual death. About every 34 seconds, someone in the US has a heart attack. The physical damage due to heart attack can be minimized by early intervention, so prompt recognition of the signs of a heart attack and immediate transport to a hospital is crucial and greatly increases the chance of survival. 4. Call emergency services immediately. Act immediately and call 911 or other emergency services in your area if you suspect someone is having a heart attack. Even if they don't display all or even the majority of the signs and symptoms, calling for medical help is the most important action you can take for someone in severe distress. 8. Emergency medical services, EMS, can begin treatment as soon as they arrive and are trained to revive someone whose heart has completely stopped. If you can't call 911 for some reason, ask a bystander to call and give you updates as to the estimated arrival of emergency services. Patients with chest pain and suspected heart attack who arrive by ambulance usually receive faster attention and treatment at hospitals.